Hi everybody, my name is Shay Preble and I'm going to be doing my presentation on the obesity epidemic. So this image I thought was really important. It shows how significant this epidemic has been. This is the obesity percentage of obese adults in the United States from 2018. As you can see, every single state is affected. The lowest percentage is 20 to 25%, and the highest is 35 plus percent, which is quite a bit. I thought this was really significant because it shows how prominent obesity is in the United States right now. As far as how obesity has been understood, uh, it, so first of all, obesity has been increasing in incidence since the 1960s. Prior to that, obesity was seen as a sign of wealth, a sign of being able to get the nutrients you need, get excess of those nutrients. While since the 1960s, when food has been more abundant, obesity has kind of taken a turn to be a little bit more misunderstood. People have seen it as laziness, and as of late, it's body acceptance, but we'll get into more of that later on. For what causes disease and how they come to that conclusion and what has changed. Um, Quite literally, obesity is the result of intaking too many calories and maintaining a body mass habitus that is 35 plus at the BMI score. As far as kind of how the disease comes about, people used to think of it as a result of gluttony, sloth, and greed, which are some of the seven deadly sins. So it had some religious undertones where people felt that those people who are obese were sinful. Later on, people kind of just see laziness as, or obesity as a form of laziness. However, with more mental health studies, obesity has been linked to mental illness such as depression, anxiety, and obsessive disorders. So therefore, most of society today does feel that obesity is linked to mental illness and is kind of a symptom of mental illness. However, there has been a shift towards body acceptance, and some people refuse to think of obesity as a disease, and they feel that it should be normalized. As far as the definition of obesity, it really hasn't changed. It's just a BMI, body mass index of 30 plus, which is a ratio of height to weight. So symptoms attributed to this disease, of course, larger body size, but there are symptoms in every single body system that you'll see. The first thing that kind of became relevant to obesity was heart disease. Later on, gastrointestinal diseases like reflux and diabetes, which causes a plethora of symptoms, were linked to diabetes, or I'm sorry, to obesity. And now it's known that obesity contributes to 13 types of cancer. So all of the symptoms related to all of these cancers is also a result of obesity. And mental disorders have also been correlated with obesity. So all of those symptoms as well. How it's been treated in the medical community. It used to be like I said, when it was around the time when people felt it was a form of gluttony, the medical professionals saw it as a problem with spirit and, a religious problem, a sinful problem, not anything medical. But as we related obesity to more diseases, it's been taken more seriously. There's more concern because of childhood onset obesity. And so medical professionals today, they'll be the first to tell you that your body mass habitus is very, very important to your health, your long-term health, and your short-term health, as well as your quality of life. And it's definitely currently a huge topic discussion in the medical community. As far as what they can prescribe or do for obesity, obviously encourage healthier eating habits and exercise habits. There are also surgical remedies like gastric sleeves that they can perform to try and reduce someone's weight. There are also medications for people with mental illness contributing to their obesity. And something interesting is most recently, there's with the shift of body positivity, some doctors have felt better not addressing obesity as a form of respect towards their patient, which I think is very interesting. How has this been seen in society? Like I said, people have viewed it as laziness, as sloth, as greed. But with these studies on mental illness, people have seen it as a psychological problem. And with the new shift, people are starting to accept bodies of all shapes and sizes, which is interesting. And here are my sources. Thank you very much for listening.